Please like, subscribe and share Mumtaa for daily updates regarding pregnancy, ovulation and periods. Pregnancy is an exciting time in a woman's life, but it can also be a confusing and overwhelming experience. With so many changes happening in your body and so many new experiences to navigate, it's natural to have a lot of questions. In this video, we'll answer some of the most common pregnancy questions to help you feel more confident and informed during this special time. What are the early signs of pregnancy? The most common early signs of pregnancy include missed periods, nausea and vomiting, breast tenderness, fatigue, and frequent urination. However, not all women experience these symptoms, so it's important to take a pregnancy test if you suspect you may be pregnant. How much weight should I gain during pregnancy? The amount of weight you should gain during pregnancy depends on your pre-pregnancy weight and body mass index, BMI. Generally, women with a normal BMI should gain 25 to 35 pounds during pregnancy, while women who are underweight should gain 28 to 40 pounds, and women who are overweight should gain 15 to 25 pounds. Can I exercise during pregnancy? Yes, exercise is generally safe and recommended during pregnancy, but it's important to talk to your healthcare provider before starting or continuing an exercise program. Low-impact activities such as walking, swimming, and prenatal yoga are great options for pregnant women. What foods should I avoid during pregnancy? During pregnancy, it's important to avoid certain foods that can be harmful to you and your baby. These include raw or undercooked meat, fish with high levels of mercury, unpasteurized dairy products, and raw or undercooked eggs. You should also limit your intake of caffeine and avoid alcohol and smoking altogether. When should I start prenatal care? You should schedule your first prenatal appointment as soon as you suspect you're pregnant or have missed a period. Regular prenatal care is important for monitoring the health of you and your baby throughout pregnancy. How often will I have prenatal appointments? The frequency of your prenatal appointments will depend on your individual pregnancy and healthcare provider. Generally, you can expect to have monthly appointments until the third trimester, when they may become more frequent. Can I have sex during pregnancy? Yes, it's generally safe to have sex during pregnancy, but it's important to talk to your healthcare provider if you have any concerns or complications. What should I pack in my hospital bag? Some essential items to pack in your hospital bag include comfortable clothes, toiletries, nursing bras and pads, baby clothes, and a car seat for your baby's ride home. How will I know when I'm in labor? Signs of labor vary from woman to woman, but may include contractions, back pain, a bloody show, and water breaking. It's important to talk to your healthcare provider about what to expect during labor and when to call if you have any concerns. In conclusion, pregnancy can be a challenging and exciting experience. Having answers to some of the most common pregnancy questions can help alleviate some of the stress and uncertainty that comes with this journey. Remember to always consult your healthcare provider with any concerns or questions you may have during your pregnancy. Thanks for watching the video. Please subscribe channel.